Hey everybody, thanks for joining us today. We'll be starting very shortly. We're just going to give people a little bit more time to join. We'll be back in just a moment. Thanks for waiting. Good afternoon, everybody. My name is Mike Virgil. I am a physical therapist and clinic director of the Union Square Clinic on East 14th Street for Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those of you who are joining for the first time. We appreciate you taking time out of your busy day to learn with us. For those of you who don't know who we are, Spear is a private outpatient practice that has been around for over 20 years. Currently 21 locations located all over the NYC area. We have successfully continued to offer in-person care throughout the COVID-19 pandemic, as well as have launched Spear Live for those of you who are looking to stay in and receive care using our telehealth platform from the comfort of your home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everybody. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We're here for you in whichever way makes you feel most comfortable. If you are looking for individualized care, either in clinic or through telehealth, please reach out to us at your convenience and we'll get you set up for an appointment right away. We're super excited to be with you today to discuss low back pain and how to treat it from home. We'll be discussing lumbar anatomy, common back pain diagnoses, as well as treatment methods to address and improve these conditions. As part of our session today, we'll be talking through and demonstrating some of these exercises. We welcome you to follow along and practice with us as you feel comfortable. Please note if you're experiencing any pain at all while performing any of these, and or if you feel unsteady or unsafe to do them on your own, please stop and reach out to us directly so that we can support you. As you can see, some of us are coming to you live from our own homes, and although we don't anticipate any technical issues today, please be patient should any arise as we navigate working through the technology. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. To find where that is, please take a moment to hover your mouse at the bottom of your screen. You'll see a Q&A option pop up. That is where you'll put questions, and we will do our best to address as many as we can during the webinar towards the end. It is best to put questions in the Q&A. If you put questions in the chat feature, we will likely be unable to get to them during this webinar. For those of you watching through YouTube Live, we are monitoring the comment section there as well, so please feel free to type your questions in. So let's talk more about our goals for the day and what we'll be covering. So first, we're going to review lumbar, spine, and hip anatomy. We're going to explain common back pain conditions and their prevalence. We're going to discuss treatment methods for low back pain and lifestyle modifications, and we're going to answer your questions live on screen. Before we get started, I'd like to introduce our team of panelists. We're going to welcome everybody on the screen now. Our presenters today are Mary V. Lau and Scott Lewis. Mary V. and Scott are both physical therapists along with me at our Union Square office. Hey, Mary V. and Scott, good to see you guys.
Hey, everyone.
And lastly, we have Kate Essler, who's also a physical therapist and our clinic director at our Tribeca Park Place office. She'll be helping us with answering your questions in the Q&A today. So let's get started. Kate and I are gonna say goodbye for now. Mary V. and Scott will let you take it away with some information on lower back anatomy.
Thanks, Mike. Hi, everyone. I'm Mary V. So today we'll be going over some basic spinal anatomy. Now, the low back may seem complicated at first glance, but we are here to simplify it so that we can all better understand how things are connected. Our low back is composed of bones, which are also known as vertebrae. They sit on top of each other and are composed of various joints that allow for motion of our trunk. Now, this includes various motions, front to back, side to side, and even twisting motions. Between each vertebrae, we have a disc that provides a cushion between each segment. These vertebrae also allow us to support and stabilize our upper body, including our head and neck. And lastly, our vertebrae protect our spinal cord, which allows us to control movement and sensations in our legs. Now, we won't go into too much detail of the various muscles surrounding the lumbar spine, but it's definitely important to note the purpose that they serve. Not only do they provide us the ability to move around, these muscles also play an integral role in providing stability to our torso. The many muscles that surround our low back and even our hips often work together so they can help us brace ourselves to prevent injury and allow us to move within a pain-free motion. The lumbar spine is naturally sturdy and resilient, and it is meant to withstand high degrees of stress and load. Unfortunately, this also makes the low back more susceptible to various problems, which is why low back pain is a fairly common thing among individuals. Now, next up, Scott will be taking over to discuss various causes of low back pain. Take it away, Scott.
Thanks, Mary. Appreciate it. There are a few common causes of low back pain. One of these common causes is from living a sedentary lifestyle. When you aren't moving around and staying active, you're not challenging your core, back, or hip muscles, which are all instrumental in supporting your low back. Another common contributing factor is the posture you have when sitting or standing. You could be overstretching or even tightening muscles because of your sitting or standing posture. You may even be putting a lot of strain on your spinal joints. Correcting your posture can help reduce or prevent low back pain by regulating how much demand you put on each of these muscles. And then lastly, another common one we see in our clinics are traumatic events that result in injury. These are events such as when you bend forward to tie your shoes, lift an object with poor form, or hyperextend or rotate your back, and it results in an acute moment of pain. Sometimes these events can result in disc herniations, muscle strains, or irritation of the nerves that run out from your spine and feed into your legs. There are several other causes of low back pain, but these are the more common causes that we see in our clinics. Regardless of what causes your pain, We recommend consulting with a physical therapist or a doctor to develop a plan of care that best suits you. In this next section, we'll guide you through foundational exercises to address these possible causes of your low back pain. For a specific diagnosis of the cause of your symptoms, we recommend that you consult a doctor or a physical therapist. Let your symptoms be your guide through these activities. If your symptoms increase despite modifications and cues we provide, please stop the activity. All righty, we're going to get situated so we can show you all these exercises now. That look good? I think so. All righty. We're going to start off with an exercise called an ab brace. This exercise targets the deepest abdominal muscle you have. It looks like a flat sheet that wraps from your spine all the way to your stomach. To perform this exercise, lay on your back, just like Maravi is doing, with your knees bent up and feet on the surface you're laying on. If bending your knees causes too much pain, then just straighten out your legs and let them be flat. Whatever is most comfortable for you. Next, pull your belly button down and in towards your spine. You should feel your stomach sink in. A good way to check yourself is doing what Maravi's doing here, placing your hands on your stomach. If you feel your abs press up, you're using more of those superficial, surface level six-pack ab muscles. We want to get that muscle that's as deep as we can go. So you should feel your hands sink into your stomach. Good. Maravi's going to demonstrate some. Perfect. Look at that form. She's going to hold this ab brace for 5 seconds and then slowly release it. You can perform 3 sets of 10 repetitions to start. Okay. Next, we're going to do a pelvic tilt, it's called. It's a great way to engage your core muscles and bring your spine into a more neutral and supported alignment. So we'll start here again, laying on your back with your knees bent up. You'll press your low back down towards the floor and hold for 5 seconds. You can place your hands on your low belly and feel the muscles contract underneath your hands. You can repeat this for 10 to 20 reps. And a great progression of this exercise is to practice this in a seated or standing position. So Maravi is going to do a couple. Perfect form. It's like she does this for a living or something. Well, thank you. All righty. Next thing we're going to do is a bridge. This is to target your glutes and your hamstrings. Sometimes you may also feel this in your quads in the front of your thighs or in your back. We want to limit how much muscle contraction or pain you're feeling in your back as much as possible when you're doing these. So you're going to stay in this position, laying down on your back with your knees bent up. A cue I like to give to limit how much of your back you use when you're bridging is by pushing your knees out and away from you. And because you do that, your hips lift up. That should help engage your glutes and those hamstrings more and prevent overextending your lower back. Good. Perfect. To make this more challenging, you can hold for 5 seconds at the top. You can also march each leg off of the ground, just like that. Good. And then Maravi, come down. You can even do a single leg bridge if you need even more of a challenge. Yeah, there you go. Wonderful. So again, to start out, you can do 3 sets of 10 repetitions. Do whichever variation best suits you. Follow your symptoms. Let them be your guide of how much you push yourself and how much you need to load and challenge your muscles. Okay. Then we're going to show you the next progression. It's called a dead bug. You'll be laying on your back, same position, and we're going to raise both your legs up into a 90-90 position. Keep in mind you want to keep that pelvic tilt and that ab brace that we showed you at the start throughout the entirety of this exercise. You're going to start by slowly tapping one of your heels down towards the floor without bending your knee, and then slowly bring the leg back to the starting position. Then you'll repeat this on the opposite side. Good, and come back up, and you can continue to alternate, just like so. Good.
Hey, Scott and Mary V, we had a quick question from the field here. So Candace wanted to know if she can do these moves if they have a sway back or a curved spine, if these movements might be safe.
So it depends on how intense your curve is, right? Like I was saying before, we want to make sure we're following your symptoms as your guide. The ab bracing and the pelvic tilt are a good place to start. If the dead bug feels okay, then it's all right to do. I would do the variation that we just showed. But we're going to show you another variation next also.
Great. Thanks, Scott.
Absolutely. Okay. So if the dead bug variation we just showed you isn't challenging enough for you, you can start to incorporate your arms into this exercise too. So then you would tap your heel down and then reach your opposite arm away from you and then come on back up. Good. And then Mary V would switch and do the other leg and the other arm. Perfect. Alternating like so. Doing slower, more controlled motions are ideal here to get that core stability we're looking for.
Looks great, guys. Another quick question. Vendela wanted to know, are you just supposed to suck in your stomach while you do the ab brace?
Yeah. So ideally, you want to draw your belly button in, but also think about that pelvic tilt that we went over. So you never want your back to be arched because that puts a lot of pressure on your low back. So you want to think about really pressing down to maintain that neutral alignment in your low back. So it's not just about like sucking your belly button in, but more engaging those core muscles.
Awesome. Thanks, guys. Back to you.
Thanks, Mike. All right. Next up, we got a fun one for you, Mary V. We're going to do some planks.
Woo, all right.
There are many variations of this very common exercise. Planks help strengthen your core and abdominals in this anti-extending motion. So we're going to set up with your forearms and elbows on the ground. You're going to keep your hands separated. And then you're going to lift your hips off the ground and your toes will stay in contact. Good. You want to keep a neutral spine and prevent sagging at your hips, right? So we don't want to do that where she's dipping down too much. So then I would have Mary V, lift her stomach more off the ground and see how she's in a nice straight line. That's what we're looking for. Okay, you can take a break.
All right.
You're working hard.
Thanks.
All righty. Yeah, so let's see. Another variation you can do is by going in the same setup, forearms and elbows on the ground, and then just keep your knees on the floor as well, and then coming up into the plank. This is going to bring the level of difficulty down one. Good, perfect.
Yeah.
And then another variation you can perform is a bear plank. For this variation, you can put your hands on the ground, elbows stay straight, and your arms are in line with your shoulders, and your knees are in line with your hips. Then you're going to lift your knees off of the ground. And then from there, the 4 contact points you have are your toes and your hands. Make sure, again, while you're doing this, your knees stay in line with your hips. You come up into that plank, that bear plank, excuse me. Okay, you can relax.
I was gonna make Mary V hold that. We had a question about dead bugs.
Good.
Someone wanted to know, what about doing them with your legs going straight out?
You can definitely do that. That's going to be more challenging than the variation that we showed you. Again, when you're doing that, I would really focus on that pelvic tilt that we talked about at the beginning. Make sure your back stays flat against whatever surface you're on the entire time.
Awesome. Thanks, guys.
Thank you. All righty. So when we're doing planks, we can hold them for 30 seconds and do 3 sets of them. Good. All righty. Next one we're going to show you is a cat cow, or I've heard it also cat camel. I think it's a hot debate. Okay. So this one is more for improving your mobility. On the floor or on a yoga mat like Mary V's on, you're going to go into hands and knees in a tabletop position. Let your belly hang down and arch your back to start. Then you're going to look down towards your belly and hollow out your back. Good. Think about pushing your back towards the ceiling when you do this portion of it. You can also incorporate some breathing with this one, inhaling as you look down and exhaling as you look up. You can do this for 30 times as a good starting point. Perfect. Great work, Maravi.
Thank you, Scott.
Thank you. Alrighty, we're gonna switch on over. Maravi's gonna explain the next set of exercises and I'm gonna demonstrate. I'm already working up a sweat watching her, but now it's time for me to sweat.
All right, your turn, Scott. I'm already nice and warm. Hey, everyone. All right. So Scott's starting off nice and easy with a good stretch for his low back. We will be starting off with a child's pose. So it's a good way to stretch out your back muscles, spines, and your lat muscles. So I'm going to have Scott kneel on the mat with his legs together. He's going to sit on his butt onto his heels, and he's going to let his chest move down towards the floor. Awesome. Yep. And now he's going to walk his hands away from up towards the top of his yoga mat. Exactly. So he's trying to maintain contact between his heels and his butt for about 30 seconds. If you have more one-sided back pain, you can also bend your torso slightly to the side, opposite of the one that's bothering you. Yeah. So Scott here is leaning over towards his left side. So he's stretching out his right side. Good. Perfect. And that gap will allow him to stretch those tight muscles on the affected side. So another one up next is another mobility exercise. So we call those thread the needles. So in that same tabletop position that I was in earlier, yeah, he's going to work on some rotational movements. He's going to lift one arm up and he's going to open his body up towards the ceiling. Perfect. He can even let his gaze follow his hands. Nice, Scott. And then he is going to thread that same arm that's up towards the ceiling underneath his opposite arm to provide a counter stretch. Good. He can hold for about 5 seconds and then he will repeat. And then he can repeat that up to 10 times and then switch off to the other side. Good. It's important to remember here to move within that pain-free range. Nice. So Scott, he's going to stretch out the back of his hips next with something called a figure 4 stretch. Awesome. So this stretches out a muscle called your piriformis, which is very important for some low back pain issues. You have a sciatic nerve that runs through it, and it also affects like the nerves that run down the back of your leg. So for anyone having tingling or numbness down the back of their leg, this one could be really good for you. So he's going to bend one knee up. Good. Yes, he's going to start off on his back and he's going to have both knees bent and he's going to cross his ankle over his knee. Perfect. So in this position, he's starting to stretch out his right side. Exactly. Yep, that's it. And then he's going to take both arms and reach behind his leg that's on the ground. And then he's going to start to bring his legs towards his chest. Yeah. Feeling that stretch, Scott?
Oh, yeah.
Awesome. Yeah. So you can hold that up to 30 seconds, kind of edge off and repeat that up to 3 times and even switch sides.
Hey guys, sorry to interrupt. I have another question from the field. This is more applying to some of the ones we showed on the hands and knees. Someone asked, what if someone has issues to support their body with their arms? Are there modifications that you would recommend?
Yes. So with some of the like more stretches, there's another way where you could do that. If you have wrist problems, you can also try making a fist. There's also versions where you can do it on your knees for those rotational movements. So we can do like a half kneeling. Oh yeah, you can show the fist one. Yeah, that takes a lot of the pressure off your wrist. Yeah. Another version you can do is like even sitting back on your heels like that. You can do your cat cows, right? It's less pressure on your upper body. Yeah.
That looks good, Scott. Great
Yeah.
demonstration.
Awesome. And
All right.
another version he can do also is if you're like half kneeling, and we can do some twisting motions that way. So, exactly.
Awesome. Thanks, guys. That's really helpful.
No problem. All right. Scott, I feel like you have all the easy exercises. You're just stretching away.
There's all the motion ones.
Yeah.
Loosen up.
So next up is a hamstring stretch. So back pain is often associated with some neural tension, especially when your symptoms radiate down your leg, something like sciatica. Another way to mobilize the nerves and reduce some of that tension is a dynamic hamstring stretch. So I'm going to have Scott lay on his back. Nice. He is going to reach both hands behind one leg. Perfect. And he's going to slowly straighten out his knee as much as he can. Perfect. And now he's going to bring his toes towards him. Good. And now he's going to reverse that process. So he's going to point and bend. Exactly. So he's going to repeat that up to 30 times. Perfect. Good. And it's a good way to get a good stretch in those hamstrings. How does that feel, Scott?
I don't know if you guys can see. It's something to shake if I go too hard. It's just a good, nice stretch that way.
Nice. All right. So that is that. And now we're going to have Scott up and moving. So we got some squats ready for him. Awesome. So squats are another classic lower body strengthening exercise. There are a ton of different ways to squat, but we're just going to give you some general guidelines. But if this is a motion that's generally never been painful or uncomfortable, then don't fix what isn't broken. So we're going to find a squat that just works and feels best for you. There's variation in how everyone's bodies are, so we won't have to get too caught up in that. So let's have Scott start with his feet underneath his hips. Perfect. So he's going to squat down as if he's sitting down into a chair. Go ahead. There he is. Yep. And he's going to work his way back up. Yep. Perfect. So it's important here to try to maintain that neutral spine the entire time. So I'm going to have him actually face off to the side. So try that again. Good. So we don't want his back arching too much. We want to try to keep that lower belly engaged as we do that. Much better. Nice. And then we can start with 3 sets of 10 for that.
I think we should have Scott hold a squat while we do this next question. How long can general back pain, for example, a pulled muscle, last? Is there a general rule of thumb for how long until someone can get back into a workout routine?
Good. Sorry, can you just repeat the question again, Mike?
Yeah, absolutely. So the question is, how long can general low back pain last? For example, a pulled muscle. Is there a general rule of thumb for how long until someone should wait until they get back into a workout routine?
It can definitely depend, right? So there are different levels or ways that can occur. It can be as quick as a couple days, and then everything's all healed up and ready to go. Sometimes it can take around 6 weeks, right? But we want to make sure we're still maintaining use of our muscles and activation of them. That way, when everything's all healed up, it's a way more seamless transition back in. So hence where some of these kind of more like foundational exercises we're doing here, more general mobility, strengthening, stretching ones, you can start to slowly integrate these to help you get back to where you want to be.
Awesome.
Another thing to point out too is, some movement is better than no movement at all. We want to get you up and moving, but we also want to let pain be your guide, right? So if anything, really aggravates your back pain, then that's kind of a sign you should edge off and try some movements that don't bother you.
Great. I know a few people had a little trouble hearing Scott in the beginning, but we said it can really vary when you have back pain. It's very dependent on the condition, but a lot of times 6 weeks is kind of something we see often. And what we want to do is a period of rest sometimes, and then you want to slowly start to increase your motion and your activity. So a lot of these exercises Scott and Mary B are reviewing are a great first line of exercises to start before you get back into a full workout routine. I'm going to throw it back to you guys.
What happened to your Scott? your squat hold.
My legs got tired.
Yeah, it's okay. Luckily, you just have one more exercise spot. We are going to go over a hip hinge. So a hip hinge is a great functional movement that carries over to whenever you have to bend down and pick something off the floor. So I'm actually going to have Scott start by kneeling. Good. So he's going to think about bringing his hips back without having to, hunch forward, hunch your chest forward. Exactly. Yep. And then he's going to bring himself back up. Perfect. So exactly. So he's getting that like hip motion going. And then I'm going to have him work his way up to standing, and the same principles are going to apply. He's going to move his hips back without, really arching his back too far forward. Perfect. Good. Good. Now, if there's no pain, this is something that you can start to slowly load with, maybe some light weights or anything you might have around the house. There you go. He's mimicking holding a weight. Perfect. Yeah. Nice. So that was actually our last exercise for the day, and we will transition into the Q&A portion. So we'll bring Mike back in.
Thank you, guys. I was throwing a couple of questions at you on the fly, so good job managing those. We've got a couple more here from the field. One person wanted to know, if you have bad knees, how could you modify a squat?
So I would say a great way to, manage that is to really think about trying to, take some pressure off the front of your knees. So you never want to, let your knees go too far past your toes. So that's why we really use that cue to sit back. Imagine you're sitting back into a chair. Another way to go about it is to not squat so deep. You want to go within a range that's comfortable. So right before that knee pain starts to kick in.
Awesome. Thank you, guys. Another person wanted to know, is walking good or bad for lower back pain? They heard that you shouldn't use a treadmill.
So, as physical therapists, we're here to promote movement, right? Movement is good for you. It depends on what your condition is in terms of how much walking, but walking is definitely something that I would recommend. And that's where, again, I would consult with a doctor or a PT in terms of how much to dose that amount and frequency of walking.
Awesome. Yeah, I think a good rule of thumb is a lot of these are dependent on your symptoms and how intense things are, and a gradual increase is usually a really good way to go. A similar question was, is the elliptical okay for low back pain? I'll toss that to you guys.
Yeah, I mean, it's a similar principle to what Scott was discussing, right? We want to promote movement. Generally, an elliptical is a little better than walking. It takes out a lot of that impact that might occur when you're walking on a harder surface. But yes, definitely letting your symptoms be a guide, and we want to promote as much movement as we can. So elliptical is usually safe for someone with back pain.
Really, really good, really helpful, guys. Someone wanted to know, how long should you do the exercises to help with back pain?
All of the exercises in total, or each?
I think it was more of a duration, frequency, how many times a week, how often, how long, in how many weeks would you recommend people do this to help?
Okay, I would definitely say starting anywhere from 2 to 4 times a week. What I typically do with my patients is any strengthening exercises, I have them do 2 to 4 times a week, and then they come into the clinic 1 or 2 times a week, or via telehealth 1 or 2 times a week. And then all of the stretching and mobility things you can do daily.
Yeah, really good. And everyone's a little bit different, so I think a good general rule of thumb is listening to your body and making sure when you do the routine that it feels good and it doesn't hurt. One person wants to know, heat or cold for back pain relief. What do you guys think?
Yeah, so I would say it depends on what your symptoms are, right? So if you're having a little more of an acute flare-up, ice is good to get things to calm down. And for pain management, Heat's also good for pain management, but I would use heat more so if you're feeling tightness and you want to keep your muscles and the soft tissues in your back looser.
Very good. I think that might be all of the questions. We've had a couple of questions about getting handouts, PDFs, and videos. So just want to let everyone know that we will be sending out, you guys will be making it, so you guys can let them know what's on it.
Yeah, so we're going to make a handout with all of these exercises and all the parameters that we talked about. That way, all of you who watched this, which we thank you for doing, are able to see descriptions and instructions for all of them. I think we're targeting for Monday, correct? Perfect.
Wonderful. A couple more questions are rolling in. Someone wanted to know if any of these are better to do as warm-up activities before a sport or an activity. Are there a few that you recommend as doing before playing a sport or activity?
Yeah, I would say it's a great way to get your muscles engaged before a sport. You want to make sure that, your body is a little bit more warm before you stretch. It kind of just helps loosen everything up. And I think you'll start to feel a little better with some of the stretches and mobility exercises if your body is a little bit more warm. And then starting off with a lot of like the strengthening exercises, such as the bridges or the dead bugs, even squats. It's definitely a great way to, prepare your body for some higher level activity.
Awesome.
I would say also that some of the first couple ones also, like the ab brace and the pelvic tilt. I was actually just telling a patient this morning. They have trouble engaging their ab muscles, and then it's putting more demand on their back. So doing things like that just to build that neuromuscular activation, if you want the fancy word, or mind muscle connection, as I call it. That's a good way to just get things rolling before you go into your workout.
Awesome. Thanks, guys. Someone else wanted to know if you have any suggestions for a tight quadratus lumborum. Are any of these exercises what you would recommend, or any others?
Yeah, I mean, I think a great one was the child's pose that we went over, where you're reaching forward, and then you can also, depending on what side it is, start to work your way towards one side. You want to stretch away from the affected side. I think that's a good way to stretch out that QL muscle. Yeah.
You can also do another one, which I can show right now.
Go for it, Scott.
If you're standing up, so whichever side is tighter, you're gonna take that leg. So let's say this is my right side. My right side is tight. I'll take my right foot and put my toes down behind my left foot. I'll take my right hand, reach up overhead, and then I'll put my left hand, put it on my hip. And then I'm reaching to the side, and then I'm using this hand to press my hips to the side. And that should just help gap and stretch, just like that child's pose modification that Marivy was talking about.
Really helpful. Another question coming in. Can you use a foam roller on the lower back? They've heard not to. What do you guys think?
So me personally, I typically like to use more of like a lacrosse ball or something like that to get more localized one side at a time in terms of addressing like soft tissue restrictions or muscle tightness. I think a lot of times with the foam roller, it's easy to overextend your back and just irritate either soft tissues or the joints.
Yeah.
So
I would say I rarely, I don't tell my patients to use the foam roller directly on their low back, but it's a great way, to kind of work out some of those tight muscles like along the back of the hips. Yeah.
definitely.
Very good. Another question that came up was, are these helpful for mid-back pain as well? Or are there any specific of these exercises that you showed that you would recommend more for mid-back pain?
I would say more for mid-back, a lot of more of the mobility exercises. So those cat-cows or cat-camels, even those open thread the needles where Scott was on his hands and knees and he opened up towards the ceiling. It's a great way to get some motion and mobility in that mid-back.
Yeah, absolutely agree. One more question here for using a step with risers going up or down. Do you have any recommendations to avoid back pain while doing step ups or step downs?
Can you repeat the question?
Do you have any recommendations for helping to avoid back pain while doing step ups or step downs?
Yeah, so I would say keeping that pelvic that we talked about is going to be really important for that. When you're stepping up and bringing your leg up, that is one hip is going to go more into that tilt, right? So I would start by working on the pelvic tilt laying down. And when you feel ready and comfortable doing it, try it sitting down, then standing up, and then try doing that pelvic tilt while you step up, step down.
And I think you kind of hinted at this, like a good way to start to get that control and that pelvic tilt is to do even some like seated marches, right? Because that's essentially what you're doing like on a step up, what Scott's doing here. Exactly. Yep.
Nice, great demonstration, Scott, looking good. Another person wants to know, do you recommend anything in particular for people with low back pain who sit or stand at the computer a lot?
I like to tell my patients, your body wants to move, right? It's good for you. Your muscles kind of crave it sometimes. So I tell them, set a reminder in your phone that goes off hourly. And that way it just says, stand up or walk around just to loosen things up. Make sure you're not in one position for hours and hours and hours on end. That's my tip.
Yeah, that's a great point, especially now because so many people are working from home. They're not moving as much. So definitely setting like a little reminder for yourself to just get up and move, take a lap around the house, and then come back and get back to work. Yeah, it's important to just keep moving as much as you can.
Yeah, this is a great question here. Any recommendations for nurses who experience low back pain regularly? I'm constantly leaning forward and repositioning patients who are often very heavy. Any suggestions for that?
Definitely. I think that's where kind of like lifting mechanics that we talk with our patients about comes into play. I think that doing more of that hip hinging exercise is going to be a crucial one to just put more demand on your glutes and your legs and less so on your back. Especially, you can't avoid that lifting at work. You have to do it. So we want to make sure you're doing it the safest, most comfortable way.
Yeah, and since it does sound like you have to lift heavy people, doing some general strength training can be helpful as well. And under the guidance of a physical therapist or a personal trainer, somebody that can really make sure you're doing it safely and effectively. All right, someone else wants to know, while cleaning their home, the lower back gets very tight. Any suggestions for those motions? They wore a back support last time and it helped. Is a stabilization belt a good idea? What do you guys think?
Say if you feel it does help, nothing, I don't necessarily have anything against wearing a back brace or like a little bit of extra support. Ideally, you don't want to have to rely on the brace, so definitely kind of like keeping up with some strengthening, like we discussed earlier, keeping in mind those hip hinge motions to avoid too much stress on that low back, I think will come and like be very important to like help with the longevity of that back pain.
I would just add also to that, that's perfect. Doing that ab brace is targeting the muscle that is basically what the belt is mimicking, right? So you have to clean your house on a daily basis. You'll probably have to wear it for a while still, but if you're doing that ab bracing activity, you should slowly be able to wean off of it.
Thanks, guys. Someone else wanted to know a recumbent bike versus an upright bike. If you have low back pain, do you guys have a preference, or would you recommend one over the other?
For me personally, I like to give my more acute patients a recumbent bike. Just gives them that back support that they might need. When you're progressing further along and returning back and your symptoms are minimal to not happening really, then that's when I start to transition people more to an upright bike.
Yeah, and for me, I agree. Using the upright bike, you're going to use your core musculature a little bit more. So once you can tolerate it, I prefer to do that. So you get a little bit more back and core strengthening there. Somebody else wanted to know if they get back pain when they do crunches or sit-ups, even when they try to kind of brace, is there any other suggestions you would give them to help reduce pain while they're doing abdominal exercises?
Yeah, I would say if that's too much of it sounds like it might be too intense of an exercise. So you might have to start off with some of those more foundational motions. So that brace and those pelvic tilts before kind of progressing your way into a crunch. The crunch, a crunch typically works, more of your superficial abdominal muscles versus like those deep core muscles.
Yeah, and that's something that I've found is really helpful for having a therapist to teach you how to really engage those muscles correctly, because it's hard when there's multiple layers and sometimes you're not getting the right muscles to fire.
Exactly.
Somebody else wants to know if you have any suggestions on sleeping positions for people with low back pain. I'd say they have a little bit more of a specific issue, but I think for more general population, is there anything that you would recommend?
It's hard to say when it's because there's so many potential reasons you're having back pain. So I would typically just suggest whatever is comfortable. Maybe that is laying on your back. Maybe it is laying on your stomach. Maybe you need to be on your stomach, but put something under your hips. Maybe you need to be on your side. It really depends on that one.
I would say,
Yeah.
Want to try to avoid putting too much pressure on your lower back.
Yeah.
You can always try, laying on your back with maybe your knees bent or like a pillow underneath your back. If you're more of a side sleeper, you can even put a pillow between your legs, and it kind of helps keep your hips and your back a little bit more in a neutral alignment.
Yeah, and in our experience, I think everyone's a little bit different. So I would play around and see what's comfortable. But I do agree that a pillow between the knees on your side is often a good way to just feel supported and aligned. Let me see. Just reminding everybody that the video recording of this will be on our YouTube channel, and we'll also be sending out the exercises to everybody who signed up. By next week, everyone should receive that in their inbox. And there's been a few questions about injections to the back. I think I can answer this for the team. It's pretty variable. Some people feel a lot of improvement after injections to the back, corticosteroid or other. Some people don't really see much of a change. I think there's trial and error with these, and some people really feel a benefit, and some people don't always get better. Some people can get pain after, although I think it's pretty rare. Somebody wants to know any suggestions for improving their posture, which I know is a general question, but for the general public, what would you say?
Yeah, I could take it. So yeah, I would say just in general, keeping a better, I guess, more upright posture is what we promote. So thinking about like really trying to keep your body upright. Yeah, go for it, Scott. So thinking about kind of like rolling your shoulders back, so that's not too far forward, and it brings you out of like that forward and hunched motion. Exactly. So this is kind of what most people end up doing typically throughout their day. So trying to keep your chest upright. Yeah. Even if you're like sitting at work throughout the day, you want to make sure you have like a good like chair with some back support. So whether you have like a pillow or like a towel roll, this happens to be like a pretty ergonomic chair. I would say it kind of follows the natural curve of his spine. Is a great way to kind of go about that.
Thank you, guys. I think something I'd add is with everyone switching to working from home with this pandemic, a lot of us have had to find new ways to work. So keep in mind, general ergonomics are trying to keep your monitor about the level of your eyes, trying to keep your elbows bent about 90 degrees at a comfortable level, feet flat on the floor. Try not to work from your couch if you can help it. It usually doesn't go very well. So, we want to make sure we have enough time to wrap things up here. So thank you guys for your questions. If we didn't get to them, please email us. We're going to give you our contact information in a couple of minutes. And from there, We'll try to make sure we get to all of your questions. For anybody with more specific conditions, we do think your best situation would be to have a consultation or a call with one of our therapists who can really talk through your individual care. So we hope today's talk was valuable, that you learned more about low back pain and some treatment methods and lifestyle modifications to manage and improve your symptoms. We'll do our best to reach out to you directly if you did already send us a question that we didn't get to, and we'll also, again, be emailing out the exercises after the webinar with a recap of important facts as well as exercises for your reference. As a reminder, today your presenters were Mary Vilau and Scott Lewis, who are both physical therapists at our Union Square location. Feel free to jot down their contact info so you can reach out to them directly with any questions or to schedule an appointment or consultation. Our Q&A moderator was Kate Essler. She's the clinic director and physical therapist at our Tribeca Park Place office. And I'm Mike Virgil, the clinic director at Spear's Union Square office. Feel free to reach out to us as well with any questions. We'd be happy to facilitate getting you set up with one of our awesome therapists. At Spear, we treat an array of conditions from head to toe. And as a reminder, we're open for in-person visits as well as telehealth sessions. Should you feel that you could benefit from individualized guidance and treatment, please don't hesitate to reach out to one of us individually. We'll personally coordinate you being set up with one of our team members for an evaluation. Lastly, at Spear will be continuing to host webinars throughout 2021, covering a variety of topics. So we look forward to seeing you there. Please follow us on social media or check your inboxes to learn more about upcoming topics. Thank you guys for spending time with us today. We hope you enjoyed it, and we wish you all the best.